Hey everyone, my name is Justin Haloot. I'm currently a second-year cardiology fellow at Baylor College of Medicine. It's my pleasure today to be here with Professor Osmancik, who just recently presented the PRAGUE-25 trial. Professor, thank you for joining us today.
I would like to thank you for the invitation.
Can you tell us a little bit about the trial itself?
Yes, the background of the trial was the obesity and relation with atrial fibrillation, because obesity belongs to the most important factors of atrial fibrillation. In the past, have data from non-randomized trials that weight loss was associated with improved sinus rhythm maintenance. However, it was done only in non-randomized trials, and these trials motivated patients who accepted to lifestyle modification program were compared to non-motivated patients, to controls who were patients who declined to accept the program. And but it seems that weight loss works in terms of having less AF. And we hypothesized that if we combine antiarrhythmic drugs with lifestyle modification program with weight loss, reduction in alcohol intake, and increase in physical exercise, that this combined therapy could be non-inferior to the catheter ablation, which is approved the best treatment strategy for catheter ablation patients. So what's the rationale and background of the study?
Great. And then can you tell us a little bit about the study design itself?
The study design was a multi-center prospective non-inferiority trial, randomized trial, and eligible patients were patients with AF and obesity. It means body mass index more than 30 but less than 40. And these patients who agreed to participate were randomized in 1-to-1 ratio to the catheter ablation arm or lifestyle modification antiarrhythmics arm. It means arm in which lifestyle modification was combined with antiarrhythmics. As noted, the design of the trial was non-inferiority. It means that we expected similar results in both arms, and we expected about 60% AF freedom at 1 year in both arms. And with the standard power calculation, 202 patients had to be enrolled to demonstrate non-inferiority.
Great. And then this came in great timing because the 2023 guidelines just gave a class 1 recommendation for lifestyle modification. So what was the final result from the trial?
And the final result was, with regard to the sinus rhythm maintenance, catheter ablation was clearly superior to the treatment based on lifestyle modification with antiarrhythmic treatment. But I would like to emphasize that we did not try to show that obesity doesn't work as an adjunctive treatment to catheter ablation. We tested if lifestyle modification with weight loss plus antiarrhythmics could serve an alternative to catheter ablation. So, and in our, we expected non-inferiority, so we expect similar results, but at 1 year follow-up, AF freedom was present in 73% of patients in the catheter ablation group, but only 35% of patients in the lifestyle modification group. It was the primary outcome, but there were a lot of secondary outcomes, and the secondary outcomes were about metabolic and functional changes. And if you look at the secondary outcomes, there were a clear significant improvement in patient allocated to the LFM-AID group. There was decrease in glycated hemoglobin, was a decrease in triglycerides, there was an increase in functional capacity assessed by cardiopulmonary exercise test, and these benefits were not present in the ablated patient. So the rhythm control was better in ablated patients, but the metabolic aspects were really superior in the lifestyle modification patients.
Awesome, great. And then, of course, with the trend, of course, of GLP-1 receptor agonists, was that an issue for this study?
We did not use, because the study was designed and initiated 2020, and it was just at the start of the era of GLP-1 agonists. So if we had used GLP agonists, the weight loss could be higher and the results could be better in this way. Yes, of course, and this presents a major limitation of the study. And I think to repeat a study with GLP-1 agonists could bring different results, but from my perspective, it's definitely no doubt that treatment of obesity is positive, and it proves cardiovascular world, general health, so on. But if there is a patient with obesity and atrial fibrillation, it seems to be too late to treat AFib only using preventive programs like decrease of body weight.
Thank you so much for taking the time to be here with us. We greatly appreciate it. And then for any more videos like this, please check us out on our channel at youtube.com/FITsOnTheGo.